So basically, just let's look at a bit of a quick introduction on this particular unit. Um, let me just, yeah, now it's live. That's great. So we are looking at starting the communication skills in health and social care unit today. Now, this is an important unit, keeping in mind communication, as you know, is the key as far as when we deal with patients or when you offer services or when you are basically working in a team. Communication tends to be the key. If you're able to understand your colleagues, your friends, peers, family members, and in general people, then obviously it does away with a lot of barriers that we can have while working within a particular setup. Now, the main theme of this particular unit is to try and have and develop a knowledge and understanding of how communication works within the health and social care sector. Now, there are bits and pieces which will be relating to personal skills and professional skills. And what we will do is when we cover this particular unit, we're going to be focusing on both the skills that are required for making and doing effective personal communication, and also at the same time looking at how do we use some of these skills that we have to be able to do or communicate more professionally with our colleagues, or when we are working within a particular setup. Now, in this unit, there are 3 learning outcomes. So there will be 4 sessions that we're going to be doing. The first learning outcome primarily is a theoretical one because it talks about know-how. That means you're going to be looking at gaining knowledge and understanding some of the basic theoretical frameworks, key models of communication, and how communication in general today happens with the use of technology. If I go back 30 years, probably without the advent of the internet, I think some part of this communication that we do using Zoom meetings and technology would not have been possible. And most of this would have been done in a classroom-based, face-to-face setting. So we will look at the first learning outcome today, and we are going to be focused on primarily understanding the key models of communication. How does communication happen using technology, and what is the role of technology in terms of facilitating this communication between individuals and teams? We'll also look at understanding different models. So when we say different models, we look at formal communication, informal communication. We look at understanding briefly verbal communication, written form of communication, and we'll go through some of this to get some overview and elemental idea in terms of how, when we do classification of how we communicate, we can look at the classification in this first learning outcome. There are one merit and 1 distinction criteria, and these would be looking at understanding if there are barriers, what kind of barriers do we face when we do communicate with each other. If I have the internet connection going down, that would mean the technology would act as a barrier right now, and it would disrupt our communication in terms of delivery of this session today. So there will be things that we will discuss primarily to understand how sometimes barriers can be overcome with technology, and how sometimes when we are communicating, the barriers do not allow us to do effective communication. The second and third learning outcome in particular are going to be what are called, practical outcomes, because here we need to be able to interact. That means we need to be able to practically do some of these tasks to be able to, complete the learning outcomes. So learning outcome 2 basically focuses on understanding the different styles and methods through which we can communicate orally. That means verbal communication in particular. We'll be looking at body language as a means of communication. We'll look at different forms of oral communication and the different types of communication, systems or languages which have come up over the years is what we will also be looking at understanding briefly here. Now, we are not going to be going into understanding how we use, say, for example, the British Sign Language or Marketed or some of the other, specialist sign languages. But the idea here would be to understand how do we use appropriate communication techniques to be able to effectively speak to, colleagues, peers, friends, families, customers, clients, patients in while using what is called oral or verbal communication. We are going to be then looking at learning outcome 3, which basically focuses on written part of the communication. And here, after understanding in the first learning outcome, formal and informal, written and verbal forms of communication, learning outcome 2 focuses on verbal communication, and learning outcome 3 focuses on written communication. So here we are going to be looking at using 1 or 2 templates that we will be filling in, and they will become a part and parcel of our assignment. And here the idea would be to try and understand what are the different forms of written communication, things like email, letter, formal email, formal letter, look at a personal statement, look at your CV. Maybe sometimes we look at a leaflet and a flyer that you get at the hospital or from a surgery, which gives you information about, say, for example, COVID. And sometimes, when you go about, you get different flyers which you pick up from the surgery, and these are basically visual forms of communication that you get. For the merit and distinction criteria, we'll be looking at other forms of communication, which typically include things like how do doctors, nurses, and maybe technology, when it comes to our aid, allows us to understand and use them to read different forms of communication which are coming out as output. So one such example would be when you do an X-ray and the doctor sees the X-ray, or when you do an ECG, an electrocardiogram, how does the doctor read that electrocardiogram? You look at, lots and lots of different types of output which come across from medical equipment, and these can then be utilized and obviously analyzed to get proper information about a particular, symptom or disease or a condition which is affecting a patient. And these would be the merit and distinction criteria that we will look at in terms of how we look at understanding information which is coming out from graphs, diagrams, artwork. They sometimes tend to be written oblique, let's say picture-based information, and that would be covered in learning outcome 3. So today we are going to be focusing on learning outcome 1, which is mostly theoretical, and some part of our discussion, as you always know, we will start this discussion with a PowerPoint presentation. And the idea here would be to look at this presentation to discuss some of the assessment criteria and build our understanding on, the learning outcome 1, which is know how health and social care organizations effectively communicate. Now, before I get into this, what I would want to do is basically look at, understanding why is this important within the health and social care sector. So when we look at, some of the basic bits of principles of effective communication, this part of the learning outcome, or essentially part of this unit, is focused on understanding it from a context of health and social care. Now, communication forms a very important part when you're working within a team or within a health and social care setup. So things like health and social care workers, health and social care assistant, nurses, doctors, any other type of staff which is working within administrative or operational duties within a hospital, A&E department, surgery, or any sort of a setup, would need to have good and effective communication skills. That means you need to be able to speak properly, listen, you need to be able to write and also read, which allows you to interpret information. And obviously then after interpreting this information, you're able to then, communicate with your colleagues. Now, communication, when we look at, is a bit of a process. And what we want to be able to do is understand what is this particular process. Now, if you imagine a situation wherein between us right now, there are a couple of things happening. One, I am the one who's basically speaking. So I am the sender of the information, which is maybe sharing a PowerPoint slide and obviously giving you a bit of verbatim or commentary on what the slide is actually talking about. In the middle, you would see there is this message, which is my instructions, or what I'm describing is actually being transmitted using what is called technology. So in this case, in the middle, you'll also see that we have got what is called, a PC, microphone, a camera, and essentially on your side, you have something very similar, which basically is allowing you to receive this particular side of the message. So if I put across maybe another slide just to describe, say, for example, what is happening as a process. So when we talk about communication process, what you're going to see is essentially a couple of things which are, happening in this process. So one, I'm the sender. I'm using some sort of a technology in the middle to be able to send message across to you, which is the PowerPoint slide that you receive and the voice that you're receiving from the speakers. What tends to happen is you then become a receiver. Now, if there are any questions that you ask either through the chat route or maybe by raising your hand or maybe asking me, to me in terms of verbally, that would mean that you're able to understand what I'm saying. And then you ask me a question, which is maybe feedback, and that is being relayed back to me to further add on or further comment on. Now, in between, what you're seeing is that there is a lot of processing happening, and this processing that is intermediately happening between when I'm sending something across and when you're receiving it at your end. What you generally see is that this processing which is happening is the process which primarily is looking at ensuring that here from my end, my communication, my voice is being transmitted, coded into some sort of a pathway using the technology, and then this is being decoded at your end before it is being received as voice. And what you get to hear it as an end result is primarily the output of what I'm speaking at this moment and explaining the slide. So this bit of processing which happens in the middle would be a process, and that process would be technological process in this case, because we're using internet, PC, microphone, and a camera to be able to send communication or the information on the slide across to you. So communication tends to be a 5-step process, and this 5-step process tends to be consisting of sender, receiver, the feedback loop, which allows you to pass me information which you understand, what you don't understand, and in the middle you have what is called essentially some sort of processing which is happening, which is making this process or this thing work. Now, if I bring across something like this, just to explain this in a bit more detail. So what I was mentioning earlier was, if you see that if I'm the sender, when I use technology, there is some sort of, and if I give you another example, say for example, if I send an email to you, what happens is I cannot just type an email. I have to use an email editor or some sort of a software which basically will encode the message, and then over the internet that will be transmitted, and then you will receive it at your end using a software like an Outlook or maybe a Gmail or Hotmail, and that editor will then open the message, and when it decodes the message, you're able to see the message, what has been written in that email. Now, when you reply to it, you're essentially giving feedback. So for example, you say, I've received your email, or I acknowledge your email, and that is a bit of feedback which happens. Now, what is noise in the middle? Noise in the middle is primarily a process wherein what tends to happen is that sometimes when you send something across and it doesn't reach the intended recipient on time, or it doesn't reach the intended, doesn't give you the intended outcome. For example, the email ends up in your junk or spam folder. Now that would be considered as noise because of the fact that what you've tried to do has gone in, but has not gone in and got delivered to the right channel. So that means you might need to change your spam or filter settings to ensure that all emails are delivered to your inbox. But sometimes what will happen is, if there is voice distortion, if there is distortion in terms of signal, what you will generally see is that the voice will become muffled and you'll not be able to hear it, or let's say clearly. Now, in that case, if there is background noise happening in the background, for example, if I switch on the phone and I start talking on the phone, or you're not able to hear me clearly because there is some sort of an interference, if I increase the fan speed, and as what you will see is that there will be a bit of distortion coming, and that would essentially mean that noise or some sort of a distortion is also coming along in the process, and that would mean at some stage this would not be very clearly audible or clearly visible to you. So in those cases, when the communication process is hindered or does have some sort of distortion, then that would be treated as what is called noise. And this tends to be what is called the communication process. So it's a 5-step process: sender, receiver, feedback. In the middle, you have the process or encoding and decoding of the message happening. And if there is any sort of distortion or disturbance in terms of how the message is communicated, then that would be treated as what is called noise. Now, this table describes the basic essence of how sometimes communication typically tends to happen. So each of the individual components thinks, for example, what is a process? It's the process or method through which we are communicating to, either visually or in some case, verbally. So if I right now, as you can see, most of it is verbal communication with the use of some presentation slides that you're able to see. But if I switch on my camera right now, what you're going to be able to see is this becomes visual communication, because I'm using both the audio as well as the camera to be able to speak to you using the camera and the audio microphone at this moment while I'm delivering this particular session. And this then becomes, to a certain extent, audio visual presentation, because you're able to see me and you're able to hear me. And this process is utilizing all the different types of communication models which are possible. And sometimes you would also see that I'm using my hands and gestures, even though I'm not in front of you, but I'm still using my hands and gestures to be able to communicate. And this is the use of body language along with the audio and visual mode of communication. So communication can be done in various different forms. I can also, communicate with you using sign language. And this is something that you get to see when you watch BBC News or Sky News in the morning. And sometimes you would see there is a presenter which is using the sign language to be able to communicate what is being discussed. Because for people who have disability in terms of not being able to hear, would be able to see the sign language and then still interpret what is being discussed about or what is being spoken about in the news. So this tends to be, there tend to be different forms of communication, which could be oral, which could be visual. It could be using a sign language. It could be using body language, which is basically uses of hands and gestures. And there are other forms of communication, which are visual communication, which can be written down. And, people who have disability in terms of not being able to see, they use braille, and that sort of communication tends to be using hands and your fingers in particular, wherein you are reading what has been written down in braille sign language, and that would allow you to decipher what is being said. They can although hear, but hearing is enabled, but visually they are not able to see, and that is where they use the touch and feel of the on the device or on the object to be able to then sense what is being spoken to or what is being shown to them visually. So different forms of communication, we'll get into it, and the idea here is to try and understand what are the different types of communication that we can get to see. Now, if I ask you a question, where do you see braille? Where do you see braille as a form of information? Braille as a form of information generally would be when you go to an ATM or when you touch, say, for example, a medicine box. You would generally see that in those cases, you have certain dotted messaging written on the box, and that is primarily for people who are visually impaired or have visual disability. Then they would be able to use their touch and feel to be able to read the dots, and that tends to communicate the information to them, with regards to what has been written on the box. You'll also see hearing in loop. Sometimes when you go to the bank, you would generally see in the banks, when you go up to the teller, you would generally see that at the teller there is a hearing in loop installed. So sometimes if you have a disability and you're not able to hear things, or you need maybe you basically have a hearing disability, and you either need to, in order for you to be able to hear clearly, what you do normally do is you put on a headphone come mic, and then you plug your headphone mic into the desk or the place where there's a phone jack, and that allows you to communicate and hear the other person clearly. And these are examples of how you would generally see hearing in loop and other things would typically happen. So when you look at the aspect of different forms of communication, all of these would involve what is called the communication process. In some cases, there'll be special visual or special audio visual aids which will be provided, like the hearing in loop or braille or sign language, but the process of communication would pretty much remain the same. Now, what we are also wanting to do today is also try and understand what are the various models of communication. So when we talk about the various models of communication, what we are also looking at is trying to understand why are these models important, how they were invented, and over a period of time, how these models have become significantly important from a point of view of looking at the reasons of in terms of how they were invented, and these models are essentially models which are used today, in terms of communication in different types of situations. So let's look at a couple of these models. There are 7 or 8 of these models. The contemporary model is generally the one which is being used in most situations now, but there are lots and lots of different types of models which have been discovered and obviously proposed over the years. And these models typically are used in one or some form of communication at any given point in time. Now, when we look at the Aristotle's model, what you're looking at is a model which was essentially proposed by the Greek philosopher Aristotle, and it was first introduced in his work as a bit of a rhetoric. That means he basically stumbled onto this, that when we do communication, there are various bits and pieces that we use, and these techniques that we use, or these, for example, processes that we use in order to communicate, was then coined into a particular model, which is what he's proposed. And this model has come across to be known as what is called the Aristotle model of communication. Now, this model is a model which is normally seen when you are looking at focusing on persuasion and public speaking. That means you're going to a seminar, you're going to a conference, you're going to a training event, and you would generally see 1 or 2 people speaking, and the others essentially, imbibing or obviously receiving what is being spoken about. And the aim here is to understand how speakers can effectively persuade an audience through their messages. So this model primarily consists of 3 main components. And these 3 main components tend to be ethos, pathos, and logos. Now, what I've done on the slide is basically explain that why this model is more suitable to when you're looking at persuasion and public speaking, specifically when you attend, say, for example, any sort of a political rally, or when you go into a particular training. Now, the 3 aspects of this particular model, which is ethos, refers to the credibility and character of the speaker. So according to Aristotle, he said that effective communicator should be somebody who should be able to establish their credibility and gain the confidence of their audience. And this can be achieved primarily by demonstrating a bit of an expertise in that field or area that they're speaking about. Also having a bit of a goodwill, or generating a bit of a goodwill with the audience. And this would allow the audience to, more likely align with the speaker. And this makes the speaker's address more trustworthy and knowledgeable. So that was the first part which he proposed, that, in order for this model to be used, you need to have ethos. Now, the second part that he proposed was pathos. Now, pathos basically involves appealing to the emotions and feelings of the audience. So sometimes when you go to political rallies, you go to training events, you go to seminars, you generally see that what tends to happen is that the speaker is basically appealing to your emotions or feelings that you would normally, have during the course of that event. Imagine a situation wherein you had a speeding ticket and you received a letter through the post wherein the DVLA essentially says either take 3 points on your driving license, or essentially attend a training event which is organized on, say, for example, speeding and speed kills. So maybe what you decide is that rather than take up 3 points and 60 pounds as a fine, it's best to attend trainings and attend a refresher course. Now, when you go to that course, what you're generally seeing is at some stage, the trainer who has been training people on the perils of speeding and obviously what are the drawbacks of speeding, for a number of years, would always be appealing to your emotions and feelings as an audience, saying that, what happens if you're driving so fast and you hit somebody. So basically, they're trying to appeal to your emotions and feelings. And here, what the speaker is trying to do is, address your pathos. And Aristotle believed that sometimes when the speaker can appeal to your emotions, they are able to play a very significant role in helping you persuade not to speed in the future. And these deterrents, which would be appealing to your emotions and feelings, would primarily be termed as pathos. So effectively, most speakers who are, good at public speaking, or are good at, speaking at events, you generally see that they are able to understand the emotion and value of the audience, and they try and then speak in such a way that this can evoke some sort of an emotional response to their speech. And when they appeal to you and your emotions, you will see that they tend to try and strike a connection that allows them to engage with you while you're there for the duration of the event. The last one tends to be logos essentially. Now, logos focuses on logical and rational appealing of the message which the person is sending. So logos as a logical and rational appeal of the message. And here what Aristotle emphasized was that there is an importance of how sound reasoning and supportive arguments need to be presented by the speaker in order to gain the confidence of the audience. And that is where what they try and do is they look at the use of reasoning and evidence to get and play, or let's put it this way, convince you to be able to believe them. And these type of things, or this particular form of communication, is normally seen when you attend public events or you go to a rally, or for example, you're attending a training or a development, learning and development seminar. Is that okay? Any questions on this? Now, the second model that we talk about is what is called the Laswell's model. Now, when we talk about the Laswell's model of communication, here what we see is this model consists of 5 key elements. And when Harold Laswell essentially proposed this model of communication, his model was fundamentally looking at answering one question: who says what in which channel to whom with what effect? That is the main contention that he looked at defining a communication model to say who is saying what, in what channel are which channel are you using to say this, how are you going to say this, and what kind of an effect will it have on the receiver when you are transmitting or sharing this information. So this model consists of 5 elements, as you would say: who is the communicator, who is what message is being communicated, what is the channel being used, to whom this message is being intended to be communicated, and what could be the kind of effect which generally would be there when we look at this particular model. Now, this model is often seen as a very basic framework for analyzing communication processes and to understand the different components of communication which are involved. Now, this model also highlights that there is an importance of always looking at the communication process, which basically consists of a sender, the message, the channel, the receiver, and the feedback that you're able to provide when you receive this message. And that is where you generally see that this model becomes really very simplistic, and it basically looks at the nuances of what real world communication or communication tends to happen between colleagues, friends, peers, or friends and family members and patients, or any sort of an audience that you're speaking to. So this particular model is a very common model which we generally see being used in all forms of communication, because when you get into, say, an office meeting which your manager is called, there are a couple of you in the meeting, your manager is making or is having a discussion with all of you, you're going to see that when he has that discussion, he's going to communicate and look at eye to eye to all of you. He's going to be looking at orienting some part of the messages to individual people sitting in the room. You would generally see that his communication would consist of maybe some sort of a verbal part, in some cases maybe handout which will be passed on to you as a note, or in some cases using a presentation to be able to use to hit important points which he's planning or discussing with you in that meeting. Now, sometimes if you assume this as a situation wherein you are a part of a sales team, or your manager is basically leading a department and the department meeting is being called, your manager might speak to somebody who's handling events with a particular focus on a particular message, somebody who's handling advertising, somebody who's handling, for example, press relations, somebody who's handling, for example, sales, or any sort of below the line promotional activity. And each of this message would be oriented at a particular user. And what he would want to do is look at specific examples or specific tasks to be completed by each of these individuals. And these are things that you get to see in a health and social care setting as well. So where you would generally see a morning briefing happening, wherein you have the doctors in the ward, the nurses, the trained clinical nurses, healthcare workers, healthcare assistant, and the person who's doing the briefing would essentially be looking at recollecting or giving tasks to everybody from a point of view of what needs to be done or carried out today in terms of daily activities within, say, the hospital, or within while the doctors are doing a hospital round in the morning. Now, the third type of model that we generally get to see is what is called the Warren-Weaver model, or sometimes it is also called the linear model of communication. Now, Warren-Weaver model of communication is sometimes also called the Sharon-Weaver model of communication, because Sharon and Weaver, jointly developed this communication model, and they proposed this as what is called a mathematical model on which Claude Shannon actually worked, and Warren Weaver, basically then looked at, improvising on this particular model to focus on what is the role of transmission of information and how information can be transmitted using a communication system. So here, when we look at this particular model, we need to be looking at a couple of things, which is to say that at any given point in time, in this particular communication model, which was proposed by them, there is going to be a communication system which is going to be used to send information across. And that is where you would generally see noise or disturbance or some sort of distortion or hindrance, because this was something which was proposed when we generally get to see in the mid-20th century, there were communication systems available. So, for example, systems through the use of radio, systems as TV. When we say systems, they were available, or telephone, which were made available, and they, because of inventions which happened in the mid-20th century, these allowed communication to happen through a faster medium, or a quicker form of communication was then possible. And when we talk about these, you need to think of mediums like radio waves, Morse code, for example, which was used during the World War I and II. You look at television, you look at handheld telephone, and now in the latest 21st century, we also see the uses of internet and technology happening. So here, the focus was relaying of information, but relaying of information using what is called the communication system, some sort of a system in the middle. And this system uses information source. It then transmits. There is a channel through which you transmit, and then receiver receives it and decodes the message. And then obviously the intended recipient actually gets the message. And that is where this model is basically relevant, because with the advent of technology, we see systems being used to do communication. Now, this particular model is primarily concerned with the effective transmission of information, and it does not address any sort of an, or place any sort of a important emphasis on, how the communication is going to happen, what is the feedback process, in what context the communication is being done. But it generally fundamentally focuses on transmission of communication using the communication system. Now, one such example of this would be, use of radio and radio waves to be able to send messages across. So during, say, World War I, or when we see World War II, essentially we use Morse code or radio frequencies to be able to send messages across. And what happened in that case was a radio message which was sent was encoded, or coded in such a way that it had to be decoded on the other side when it was received after transmission, and then it was given to the intended recipient. An example of this would be a telegram. I would say if you go 30 years back, 35, 40 years back, there was a way through which you could send letters, but obviously they were slow in the form of communication as opposed, because it went through, post and things like that. But at some stage, what you would generally see is that telegram as an option was also introduced, and urgent messages could be transmitted from one post office to the other, and that allowed the messages to go across. So the focus was on transmission, so that the message could go across clearly well onto the other side. So let me just message Alina, so keep her microphone muted. Now, this particular model focuses on systems and communication system as a usage for the purposes of sending messages across. The next model that we look at is Bertels Model. Now, Bertels Model of communication takes into account the emotional aspect of the message. And this was, Alina, could you keep your microphone muted, please? So in this case, what we generally see is that when we look at David Bertels, and when he came up with this model in the 1960s, he was widely recognized to come a device, in devising this particular communication model, because it focused on the factors that influence effective communication. So what we see, effective communication and the nature through which communication happens, what he recognized for the first time was that the communication process is dynamic. That means we are able to, say or change things on an instant, because that is where the process, has various components in it, various elements in it. And if any of the element changes or it's, shifts its position, you would generally see that the messaging becomes dynamic. So he identified 4 basic things in the process, which is termed as SMCR. So the source, which refers to the person or the entity through which the communication is being initiated. We look at message, which talks about the information or the content being communicated. The channel, which is primarily what represents the medium or the means through which the message is being communicated or transmitted. And receiver, which basically focuses on the person or the group of people who are actually receiving the message and interpreting it or decoding it. And they could be using things like symbols, words, gestures, which could be used in the form of decoding this message. And that is where the receiver's importance becomes, the receiver actually becomes important. And in addition to these 4 components, Bertels also recognizes that the influence of feedback and noise are important components of the communication process. So feedback tends to be when you generally see, for example, people respond or react to a message that they receive. Sometimes when you are watching I'll give you a practical example. When you're watching a intense form of football game and your team essentially scores and you're watching it on a big screen or in a pub, you normally have a straight reaction to say, yay, they've scored. And that kind of a reaction is a feedback which primarily is, initiated by what you're watching and what you're essentially receiving. And that fills you with emotion, and with the emotions you react or basically provide that reaction. And he also acknowledged that noise, essentially, when we talk about in the communication process, refers to the interference or any form of distortion that may affect the clarity or accuracy of the message, which is involved in the communication process. So these noises could be background noise, it could be, psychological noise, some sort of a distraction, or it can also be semantic noise, which could be language barriers or misunderstandings, which could happen primarily because of the message not being interpreted properly. So this particular model, took into account as a framework of how communication can be improved and in what ways can the communication roles and interactions be assigned so that it becomes effective from a point of view of as a process. The next model that we look at is very briefly, Scaram's model. Now, there are lots of different types of model, but Scaram model of communication was proposed by, Wilbur Scaram in the late 1950s. And it's a transactional communication model. The main point of this model is that it's a transactional communication model, and it basically focuses on the process of communication and the mutual exchange of information between the sender and the receiver. So what he proposed was that there are 2 sides to the process of communication. There is a source and a destination. There's a sender and a receiver. And between the 2, there are lots of interactions which happen. And these interactions which typically happen are because of mutual exchange of information between the 2. And this mutual exchange of information typically has, a process which is the encoder, interpreter, decoder. And the same process is on the other side. And in between the 2, basically the messages are conveyed in which are basically intended for mutual exchange of information. Now, when we talk about this model, this model emphasizes that the nature of communication is interactive. So one of the key things which he proposed and he came across when we talk about this model is that he said that the nature of communication itself is interactive, and it involves both the receiver and the sender, requiring them to play what is called an active role in the exchange of information. So his process or his way of describing the communication process was that it is the transactional process which involves both the sender and the receiver playing a very active role. And this transactional process involves the exchange of communication for mutual benefit. And this transactional process is basically the kind of framework or the main framework which he proposed, that sometimes when you look at sending information, if the receiver on the other side or is not interested in receiving your information, then the process of exchange of information cannot happen. And that is why he said that if there are two ends of the spectrum, wherein you have a sender and a receiver, and they basically have their own, let's say equipment or communication systems in place, the use of these systems would be done to exchange information for mutually beneficial reasons. And because this involves interaction, feedback would be provided from both ways. So when sometimes I say something, and when on the other side you receive it, and then you talk back to me and give me some feedback, it is an interactive process rather than a one-way process. Next model that we look at is what is called the Riley's model. So when we talk about Riley's model of communication, here the Riley's model of communication focused on primarily discussing things that we have two groups. And when we talk about two groups in general, these two groups basically look at exchange of information using the communication process. And when we talk about the use of communication process, for the purposes of exchanging information, that is what Riley's model of communication actually focused on. So Riley, when he spoke about, Michael Riley was the person who basically invented this. So when he talked about, the process through which individuals or entities exchange information, and this exchange of information generally involves, three or has maybe some typical components. So these typical components tend to be, sender, receiver, channel, message, which being the same. But what he did was he grouped them together into what are called primary groups and secondary groups. So when messages are exchanged between different groups or entities, these tend to have what are called multiple exchanges or multiple, interactions. And this then allows these interactions primarily to be able to, these groups then primarily have these messages being exchanged. And when we see members of a certain primary group and members of the receiver's primary group exchanging messages, then this tends to be what he defined as what is called the Riley's model of communication. Now here, the emphasis is on mass communication. So this model basically shows that communicator, which is C, and a group, and receiver, which is an R, primarily are involved in what is called, mass, messaging, or basically exchange of mass communication. And that is where, the model focused on primary groups who are based in the communicator side, and primary groups which are based in the receiver side. And they essentially then, what is called communicate to a larger social system, which is this side, or a social structure. And then when they receive the message, they communicate back to a primary group, which is a part of a larger social structure. And this process, which basically looks at being a two-way process or a two-way communication system, generally tends to happen within a group of individuals. And that is why this particular model focused on what is called, Riley's model of communication. So here, the focus is on understanding how communication happens within social groups. And this model generally would be seen in when you have team meetings, or for example, when you're discussing, or when you're say as a lecturer, I kind of put you into different, I break you into different groups and put you into different rooms, and then ask you to do a group discussion. And when you come back together and then you discuss as groups, you present to each other, then this would be a part of a larger social group in which these discussions would typically happen, or communications would happen. And that is where we would generally see the Riley's model being used as far as communication is concerned. The last model that we talk about is the contemporary model of communication. Now, when we talk about the contemporary model of communication, here the main focus is looking at the normal or modern day-to-day style side of communication that we generally see. So here, this model kind of borrows its main theme or ideas from some of the other models, and has become widely recognized as one of the transactional models of communication. So it kind of pays emphasis on that communication as a process is dynamic, and because it is dynamic, it is also interactive, and this means that there is a simultaneous exchange of information through encoding and decoding of messages, which happens between a sender and a receiver, and this leads to the exchange of information. And exchange of information can sometimes also be accompanied with feedback or noise. And this particular model of communication would have participants. It'll have usual things like encoding and decoding a message, various channels being used, feedback being provided, and obviously context in terms of noise or distortion being observed, or disturbance happening when this particular model is being used as a transactional model to communicate, or use it for communication purposes. Now, there are lots of factors which can be at play when we talk about this particular model, and this particular model focuses on the interactivity and the social construction in terms of how communication happens within the society. So it takes into account things like the dynamics of communication, the social context of it, and what is the role of technology in shaping communication as a process. And that is why this particular process or the model has become quite popular when we discuss the various forms of communication models being used today in health and social care context or in the business context today. So when you look at imagining a surgery, you're generally seeing that when you are at the reception, you have receptionists or people at the reception who would basically call the patients up, but they will also have maybe a call out system. There might be a touch screen wherein you go in and check into the surgery. You say, I've now arrived, and it'll give you a bit of a timeline that, okay, you would be seen by the doctor in 20 minutes. You might also have a call out to say ticket number 29 or patient so-and-so, and that gives you a sign out that now the doctor is ready to see you. So as you would see, this particular model will focus on the use of technology, interactivity, communication, and various mediums through which communication can be sent out effectively to the person intended. That's one of the reasons why this model has become very popular. Any questions on learning assessment criteria 1.1? Any questions so far? Okay, let's look at assessment criteria 1.2, which talks about describing communication models that are used in health and social care organizations. Now, when we talk about so many models that we've discussed, and then in general, if we have to just focus down onto some of the communication models which can be applied and used, within health and social care context, we need to look at some of the specific models that we can generally see which are being utilized in this context. So this particular model that we look at, in health and social care organization, could be primarily used between employees, could be used, when I say employees, mean staff, nurses, doctors, consultant, any sort of workers within the particular department who are working either in a hospital or any sort of a healthcare setup. And there could be professionals, patients, and other stakeholders which could also be there. And here some of the systems that we would use is, say, for example, SBAR. So I don't know whether you've heard of a system called SBAR, But SBAR tends to be situation, background, assessment, recommendation system. Now, this is a structured communication model which is used in healthcare and social care settings because it allows very concise and effective communication to be done. Because of a simple reason that sometimes when you look at situations, when you look at background, when you look at assessment and recommendation, this particular model becomes quite clinical. An example of this would be when you look at a shift change which happens within the hospital, what you're generally going to see is that there are effective handouts being done from one set of nurses to the other or healthcare assistants to the others. And what they are going to do is basically in the handoff provide any sort of critical information which is required to be dealt with when it comes to, say, for example, medication for patients, testing of blood sugar, or for example, testing of blood pressure. And this particular system would basically mean that when the handing taking over is happening, the situation is being explained, the background is being given, an assessment to that situation and the background is being explained, and then what needs to be done is a follow-up process in terms of recommendation would be done. And this would be a framework which will be utilized by nurses, healthcare assistants, doctors, when they want to share information about a patient's situation, their relevant background, give a very professional assessment, and then recommend what actions and interventions need to be done when the shift change happens. So one of the first ways that you look at in terms of how we would generally look at the process of communication happening within a health and social care setting would be essentially what is called the SBAR system of let's say communication. So the second way that we would look at in terms of sometimes when we talk about health and social care system, you would generally see that at some stage these would essentially be done through, I would say, care pathways. Now, care pathways tend to be pathways which are designed, which are quite systematic. They have multidisciplinary communication systems which outline very clearly the steps and the interventions which are required to be done in order to ensure that the patient condition improves and not deteriorates. Now, this particular care pathway would have a very clear communication process. It'll need collaboration from a number of teams or people within the teams. And it would also mean that there'll be a very good case of coordination between healthcare members to ensure that standardized care or integrated care is provided to the patient with regards to the information being shared by the patient's family or by the doctor. So sometimes you would see care pathways also being used as an effective medium of communicating, I would say, information across to colleagues within the I would say within the the health and social care setup. Now, when we in general talk about care pathways normally are very clearly defined within a particular setup, and these care pathways essentially would be utilized by nurses, healthcare assistants, by doctors, or any relevant medical staff while they are essentially talking about any sort of care being provided to the patient. Now, we also talk about electronic, healthcare records, EHRs as we call them. Now, when we say EHRs, generally when you see or when you go and visit your doctor at the surgery, what you will generally see is that the GP surgery would have digital record of all the patients. So when we talk about digital record of all the patients, any sort of information which basically has you had any sort of symptoms, disease, or any sort of condition in the past is all recorded. Any medication which has been subscribed or prescribed to will also be recorded. Results of that treatment will also be recorded. And this will enable healthcare professionals to communicate effectively about any conditions or any sort of conditions that you might have with regards to yourself. And this would be used by the healthcare professionals to communicate and obviously collaborate should you need further care in the future. And these would be use of some of the systems which is done by the health and social care organizations in order to effectively provide, let's say, treatments to patient when they come into the surgery or the hospital or a community center or any sort of, center like pharmacy and things like that. Is that okay? Any questions on this so far? Any questions at anybody's end?
No.
Okay. Now, there could be other sorts of communications which could also be generally seen. And what I would do is primarily provide some of these for the purposes of, reading. The reason I would say is when you are in a bigger setup or a hospital, you generally see interprofessional communication happening. And this would also be sometimes mentioned as what is called multidisciplinary team working. And then if we look at one of the concepts of telemedicine and telehealth is also one form of communication which happens between doctors if they are looking at receiving, having exchanging ideas, and or in some cases where, if there are no facilities available for patients to be able to meet the physician or the doctor or the GP in person, then in those cases we use the concept of what is called telemedicine or telehealth. And that could be also a form of communication which could be done, within, I would say, modern setup of health and social care systems. So this could be wherein we are utilizing video, audio, or in some cases remotely providing healthcare advice to patients in remote areas. And these forms of models could also be generally used within the health and social care setting. Now, going to the benefits of, formal and informal forms of communication. Now, one of the things that we want to refer to is understand first what is informal and what is formal forms of communication. So when we say informal communication, informal communication or communication system, what do we mean by informal? Informal means that here the communication which is happening is happening without a very defined path. So when we talk about a defined path, what we are saying is the defined path tends to be, in the sense that we are looking at, primarily focusing on exchange of ideas, information, and messages, which could be done in a very casual manner. So when we say informal, what we are meaning by that is casual manner, when the communication is happening among friends, colleagues, or when you're having one-on-one gossip. That would be the general form of informal. When we classify that, I would say that would be informal communication. Now, informal communication tends to be flexible. It could be done, you're trying to build, say, for example, a friendship with another colleague or rapport with another colleague. It could be something which could happen in a non-defined setting while you're making a cup of tea, for example, or it might happen when you're walking in the corridor. It could be that this form of communication would generally be something which allows you to communicate in a manner wherein you are trying to build a rapport or a relationship with a particular person, and it is happening in a more relaxed setting and in a more comfortable environment. So when we talk about informal communication, what we essentially mean by that is the communication which is primarily happening in a relaxed setting and in an informal fashion, which is casual or which is on a one-on-one basis, and it is primarily for the purposes of either building a relationship or a rapport with your colleague or a number of colleagues within the organization. When we refer to formal types of communication tend to be what are called exchange of ideas or information, which is happening in a more professional setting. That means through a set of prescribed or described protocols. It follows certain rules, and there are certain language conventions. I might not say hi to you or hello to you. I might say good afternoon. That would be a form of formal communication. So if I've known somebody and I write an email to that person, I might write it as hi Fatima, or I would say hi, somebody like Chi. But if I don't know the person and I would like to address him, and if I'm writing to that person for the first time, in those cases, I would say dear Mr. So last name, or I would say dear, or I would say good afternoon or good morning, so and so, and that would become a formal part of communication. So this is normally used in the context when you're writing to somebody or speaking to somebody in a more formal context, things like when you're in a business-like situation, or when there are other contexts of professionalism required in order to ensure that the communication being done is absolutely clear in those cases, you would look at formal forms of communication. Now, when we talk about formal types of communication, what you're also going to see is there's a bit of a structure and an organization to it. The tone in which you write and the language that you choose is going to be relevant to the context in which you're writing, wherein that means you're using proper grammar, you're using appropriate vocabulary, you're avoiding the type of, say, for example, avoiding slangs or any sort of colloquial language. And this is, or you're not writing in short forms, for example, which are acronyms or, and here the idea would be to make sure that the communication is absolutely non-ambiguous and it follows a particular format in which it is being done. So these forms of communication tend to be written. They tend to follow things like letters, emails, memos, reports, and other types of documents like contracts or agreements, and they would have a sense of clarity, accountability within them, and that is why they are going to be formal forms of communication. Here, the focus is on delivering the message in a very clear and concise way, and using the use of channels which are seen that it would not be difficult for the recipient or the receiver to get the message from what is being communicated. And that is why formal forms of communication tends to be business meetings, presentations, official letters. It could be, job interviews when you go in for. You might also write reports, and in some cases, legal documents, and they would generally be looking at using formal type of communication. Now, this task talks about explaining what are the benefits and let's say the basically only focusing on the benefits of formal and informal type of communication, which can be done, say, for example, in a health and social care setting. Now, if I have to look at basically discussing first, when we talk about formal and informal, formal information can be done through verbal means, non-verbal communication, and then forms of non-formal communication. So what we need to be able to do is know at least each of the types before we actually can go in and discuss, the benefits. So when we talk about verbal communication, here the person is speaking, the other person is understanding, and obviously in some cases it will lead to question answer session, because if the questions or the information is not understood, the feedback part of it would be that you would be looking at asking questions to clarify what it means and how it means. So this would be the verbal form of communication. Non-verbal tends to be when we are not speaking, but we are using body language or in some cases sign language, and this would constitute non-verbal form of communication. Now, there are various non-verbal forms of communication. For example, facial expressions, like you see, sometimes you react by raising an eyebrow, or you frown, or your eyes, you close your eyes, you roll your eyes, you're smiling, and this tends to be facial expressions. Sometimes you touch and contact, and that would be a non-verbal form of communications. For example, if somebody's feeling very low or is heard some bad news and they need somebody to hug on, you'll physically touch or contact them, and that would be non-verbal form of communication. Gestures, proximity, eye contact, they all tend to be non-verbal forms of communication. Then we look at signs, symbols, and objects of reference. So here you're looking at various forms of objects of reference, which would be things like which sometimes are given or used in the context of communication. A simple example of this would be if you take your child across to the GP surgery and he or she has to get a form of a vaccination, the GP would generally distract the person or the child by giving some sort of a toy or an object, and that would be using it to create a distraction while the vaccination can happen. And that is where you would generally see these kind of signs, symbols, and objects being used. You could also see signs being used for British Sign Language, and obviously some of the cases wherein it's difficult to communicate. If you had a surgery and you're unable to speak, sometimes you would see the GPs using some sort of sign or pictures or posters or some sort of printouts being shown to you to get your reaction and to understand it. And in those cases, you would be looking at symbols. Technological aids I'd mentioned earlier, hearing in loop, for example, when you have disability, or for example, if people have any sort of disability, then in those cases, technology will come to your aid. And what we will see is in organizations, there will be provision wherein this technology would help the people with the disability to be able to use it and then communicate in a normal way or effective way with, for example, other people within the organization. And then we look at hearing aids. Sometimes you look at human aids, as I would say. So hearing aid would be technology. But when I talk about human aids, if I speak English and you speak Arabic, if I speak French and you speak German, if both of us has to communicate, sometimes you have to look at using a translator. And in those cases, you would generally see translators being used, and they would be termed as what are called human aids. Now, there are various other forms of alternate communication. And I mentioned you the use of what is called Braille, the British Sign Language, and Macedon, and these are other forms of communication which can also be done with with patients, with communication with different people using them. So these are just for the purposes of referring. And then when you see graphical signs, then you see when you are in a hospital, you see there's a sign, keep out, or the ground is wet, or it could avoid this place, or these kind of signs typically give you what are called visual forms of communication to say without giving you any, say, anybody who's in a location wherein there are no people to warn you or give you signs of that you should not take this route, or be careful when you are walking there, or in some cases some equipment is not allowed. For example, when you go for x-rays and things like that, you would see some of these signs being put across as health and safety hazards or as visual signs of communication. And these would then be the usages of what we call how different forms of communication can be mentioned. Now, if I have to mention the benefits, which is where the main task is, then the benefits of informal and formal communication systems can be put here just from a point of view of table of comparison. So you have flexibility and adaptability in informal, but informal, you have to have clarity and structure. Informal communication, as I explained to you, would be for rapport building, relationship building. These will primarily be for accountability and responsibility. Here, you're looking at contextual understanding. Here, you're looking at clarity of message, legal and compliance, adhering to legal and compliance. Here, the idea is to transmit information in a rapid way. So one-on-one communication tends to happen. It could be informal. Here, it is written, and it is primarily meant for retention and access or for record purposes. And that is where you'll use formal systems. And then last but not the least, when we look at training and development, which is happening within the health and social care sector, they would be benefits of formal types of communication. Any questions on the assessment criteria 1.3, which is benefits of both formal and informal communication? Okay, now in 1.4, we are looking at how technology is used for different types of communication. So we've covered some of this. We use technological aids. We use websites, which are basically using technology. And in most cases, when we see people with disability, they are going to be using technology to be able to communicate with them. And they are going to be primarily, useful for people with sometimes disability. And in some cases today, technology is also being used to ensure that we are able to communicate more effectively in a prompt and a quicker way. And these are various different types of communication that we need to cover when we talk about technological usages within health and social care. So one such bit would be, we are talking about verbal communication. We are looking at where all technology can be used. In verbal communication, we use telephones. We are using VoIP, which is voice over internet. We are using, for example, digital assistants, like you have Amazon Speaker at home or Echo Dot or Google Home. And these are voice assistants when you ask a question and they're able to research some part of the information from the internet and provide that to you. These are all verbal forms of communication and uses of using technology. Then you have written communication. We have email, text messaging, and these are written forms of communication using technology. Then we talk about visual communication, video conferencing, for example, live streaming that you normally do on events on Instagram or YouTube. We look at non-formal form of communications, and these could be, say, for example, in some cases, use of automated systems, AIs. When you call HMRC, when you call a bank, it will take you through some options which are going to ask you to select option 1 to speak to a teller, option 1 to make transfer, option 3 to receive money, things like that. So these are going to be, although non-verbal, because this is the systems being used rather than actual people or person speaking to you. And then these are the various ways in which we are looking at actually using technology to, do communication with different, people, colleagues within the organization. Is that okay? So here you need to come up with ways and means through which you can decide and write about how technology is being used to use for information. We'll quickly go across to, some of the barriers that are seen in communication. Now, barriers that we can have in communication tend to be caused by usages of things like jargon, slang. Sometimes we look at barriers which could be because of technology or noise or distortion or any sort of hindrance which is happening when two people are talking or a group is discussing amongst themselves and there's a lot of noise in the background. Now, there tends to be a lot of barriers which can affect, how communication essentially can be affected within the health and social care context. Now, when we in general talk about these barriers, we are looking at barriers and we are looking at ways to overcome these barriers. How do we overcome these barriers in communication? These barriers could be generally barriers which could be because of, say, for example, cultural differences. They could be barriers which are technological barriers. They could be barriers which are primarily because of, your primary or physical, sensory barriers. They could be emotional or psychological barriers. So there are lots of different types of barriers that we can have in doing or speaking or, having a conversation with colleagues, friends, individuals within health and social care. And some of these can be classed into language barriers. So these could be, for example, if I speak a different language, sometimes when you go to the surgery and say, for example, you speak Polish, but you've gone to a surgery and the GP needs to ask you a few questions, you would generally see that you're not able to communicate well because English is not your main language. So in those cases, what will happen is you would generally see that the doctor might need to then look at, involving an interpreter who would come in, and this interpreter would essentially, do translation, and that translation would allow the GP to understand the problem that you're having, and then the GP would be able to recommend you appropriate or give you an appropriate prescription. Sometimes you would see technological barriers. That means sometimes you would see that technology that is being used to, say, measure your blood pressure or do an X-ray is not working. And in those cases, the results do not come out to be consistent with what the doctors are looking at seeing. So they might say, repeat the blood test or repeat the X-ray test or repeat this MRI test, because the test seems to be outside the bounds of what are called the acceptable norm. So in those cases, you would see these as technological barriers. Then you see time barriers. Sometimes you would see that, you go to a GP and because he has a number of patients to see, if you try and discuss multiple problems, he would say, okay, only I've got 10 minutes. I won't be possible to give you a full consultation on this. You might need to take another appointment. So this could be a time barrier, which means allocated time required to discuss a particular set of problem with the GP is not enough. And the GP would then say, could you take another appointment? And that could be termed as another barrier. And these are all barriers which are going to be barriers as far as effective communication is concerned. So here, if I look at Liverpoolian accent or Glaswegian accent, for example, the accent could be a particular barrier because it might not allow me to understand, let's say the particular context in which when you are talking or when you are speaking, that would not be easy for me to understand, and that would cause an accent related barrier. You could have distress or emotional barriers or physiological barriers, and these could be again inhibiting the transmission or communication. And all of these that I've discussed are individual slides. So acronyms, for example, if I say PSTD, or if I say a slang, or if I use a slang word or give you a jargon, and sometimes you might ask me that, what is this? Could you expand what does this mean? So when I say HIV, if I don't know what is the full form of HIV, or if I don't understand, then using an acronym can be also a barrier. So it is, in this case, we need to be able to, not use these words sometimes, because some people might not be aware of the full forms of these, and that is where they would not interpret or understand this information in clarity, and that would tend to be also looking at different forms of barriers. Now, how do we propose solution to barriers? Proposing solution to barriers would be to make sure we don't do exactly the things that we've discussed. So don't use jargon, slangs, don't use a specific dialect or a cultural barrier. And if we don't use, or we have an understanding of how, we can deal with different type of customer, patients which have a different cultural background, would allow us to basically do away with these barriers and ensure that what we are communicating, what we are discussing is actually being understood. And that would be the barriers being solutions to basically the barriers which we can sometimes face when you are in a health and social care setting. So generally speaking, you would say that because of GP surgery today has diverse patients, or hospitals typically deal with diverse patients, a lot of trainings are done throughout the year to ensure that people understand cultural background, the traditions, what matters to the patient. And that is where these trainings are done primarily to ensure that nurses, doctors, healthcare workers, assistants, people working within the NHS are able to understand a particular culture and the reason why this particular culture believes in certain traditions. And when they are respected, means that you're overcoming those barriers. Generally, an example of this I would give you is that in certain cultures, you would generally see a woman is also accompanied by, a male, because they feel uncomfortable discussing certain set of problems with doctors or GPs. So here, maybe the spouses of the women, or for example, husbands of the women, would also accompany them for a consultation, because some part of the interpretation and their presence within the same room gives confidence to the person, and allowing the GP and the doctor and the nurse, allowing the person to be in the same room to be able to interpret and comfort the person, is helping to remove the cultural and psychological barrier, which allows the patient to be treated in its fullest and in the most, receive the treatment in the best possible form. And that is one of the ways through which you can actually remove barrier. Now, there are lots and lots of different types of technological barriers that we can see, which can be used when we talk about the distinction criteria, that how different uses of technology can enhance or detract from good communication in health and social care organizations. So here I've given a particular bit of a diagram which can be used then to expand the distinction criteria by saying that how do we use technology to overcome some of these barriers in communication. So for example, use of social media, use of campaigns, use of promotional campaigns which are done through TV, or sometimes you would see being done through leaflets and flyer distribution. And these would be use of technology to let's say overcome the barriers that we face in communication, specifically within the health and social care sector. So here I would suggest that you read into some of these. And induction in loop, for example, a hearing loop or induction loop, are technological solutions which are used to overcome barriers, and then do a bit of research and reading to be able to come and do this particular task, which is evaluation. That means you have to think creatively, pick up a piece of technology like an induction loop or any of these that I've displayed here, and then talk about how this would enhance or do away with any sort of barrier that we see primarily within the health and social care setup or within a health and social care organization. And that should allow you to complete this particular assessment criteria, which is for distinction. So with this, we come to the end of today's session, which is in detail discussing the learning outcome 1. Any questions on this so far? So feel free to ask me any questions that you have on what we've discussed today as far as learning outcome 1 is concerned. Any questions? Okay, if there are no questions, that's great, no problem. What I would do is when you go up to Moodle, there are a couple of handouts that are there. One on the theoretical theory of the communication model, and then one particular handout, which is like a ebook or an extract from an ebook, which basically talks about communication models and the theory of communication within health and social care. I would suggest that if you read that, that would give you details of, understanding in more details, or basically, let's put it this way, the theoretical aspects that what we've covered in today's session would essentially be, coming across from those particular handouts. So if I quickly go in and show you that for a minute before we close this session, I think they would be quite helpful for you. So if I go in here, which is the Moodle, and we go into the communications unit, what you're going to see is obviously learning outcome 1 here. And in learning outcome 1, what I would suggest is if you read things like understanding the principles of effective communication, the 7 C's of communication, and then overcoming barriers in communication and communications handout. These 4 handouts that are there, some would be in the form of presentation, but generally some in the form of extracts, which is going to be useful for you, to look at a bit more detailing into, the discussion on details with that the assessment criteria that we've done. But that discussion and the detailing of that discussion would be looking at covering, some parts of it in this particular handout, which is the communications handout that I put here. And that is where you would feel that some part of it, would be detailed out in terms of the slides and the main points that we've covered in the slides. So we'll have our discussion on learning outcome 2 tomorrow, same time at 11 a.m. Until then, thank you so much for attending. And I will see you tomorrow, same time, and we'll start the discussion.